Kia ora anō. Thank you, Minister. Welcome, everyone. I want to start just by briefly mentioning what's happening with the pandemic overseas. With more open borders and an ever-increasing number of cases detected at our border, this has never been more relevant. And what we are seeing globally is that the number of new weekly cases has increased week on week over the last month, after previously declining since March 2022. And this is happening even though we know that testing rates have dropped in a number of countries, especially in the Northern Hemisphere. It's quite clear this is being driven by these new BA4 and particularly BA5 subvariants of Omicron, and we are seeing a very similar pattern to what we're experiencing here in a number of Australian states, in particular New South Wales. Of course, thinking across the Tasman, their preparation and response there is informing our response, and vice versa, and we remain in regular and very close contact with our Australian counterparts. So moving to New Zealand, today we are reporting 11,382 community cases, and that includes 412 reinfections. There are 765 people in hospital with COVID, and we're reporting 23 deaths. So the 7-day rolling averages have increased for all three in the last week. For cases, that now sits at 9,826, hospitalisations is at 673, and deaths, a 7-day rolling average of 20. I want to now use a few slides just to outline what's happening with the outbreak here in New Zealand, and you can see from this first slide that's on the screen that case rates across all four regions around New Zealand have trended upwards in recent weeks. So in the week ending 10 July, there was a 32% increase in case rates compared with the week prior. And in particular, and this will be what is driving our increase in hospitalisations, which has been quite rapid, among people 65 years and older, they have increased by 33% in the week ending 10 July, so quite significant and rapid increases. Early on in our first Omicron wave, we didn't have our over 65s so impacted, and we're seeing those higher case rates there. The test results of our border workers and our wastewater reporting suggest that there is this significant increase in case rates across all regions in recent weeks. And I know there's interest always in what proportion of cases we think we are detecting through our testing. We're back to, we think, around half of cases. So probably about double the number of cases out there around the motu compared with what our testing is showing. And some of those will be people who are asymptomatic or very mild symptoms, and some may be testing but not uploading their results, and there may be some people who are simply not testing, and we'll come back to that. So the upward trend in case rates is primarily due to this increase in the Omicron BA5 subvariant, and you can see this in the next slide. This shows the proportions of the different Omicron subvariants since the outbreak commenced. Early on, it was BA1, and then BA2 rapidly took over. And you can see over these last few weeks here, quite a rapid increase in the proportion of cases that are driven by BA4 and BA5, and in particular the latter. And that is going up week on week. So the latest showing that we're at 47% of cases are BA5 related, and so that's going to continue to increase and will almost certainly over the next few weeks become the dominant variant. There's no evidence at this stage, as we've said before, and we're watching closely, that the BA5 subvariant causes more severe illness than BA2. And likewise, early analysis of BA5 shows no substantial variation or reduction in vaccine effectiveness of 3 doses of the Pfizer vaccine relative to the BA2 variant. However, BA5 is clearly better at evading immunity, and this is important for people who have been infected previously. It does not mean you are immune to being reinfected, and we are seeing a steady number of reinfections, which we're now reporting every day. It's still around 2 to 3% of our total infections, but we are expecting it to increase. And so it's very important that even people who are fully vaccinated and or have had COVID, including Omicron in the last few months to take the precautions we're going to re-emphasise today and talk more about. And just a few quick slides on modelling. This first slide is effectively what we are modelling will happen with our hospitalisations if we do nothing. In other words, if we maintain the current levels of mask use and so on. It shows a peak of more than 1,200 beds occupied per day, and that is higher than the peak hospital occupancy we had back in March. This is, as I said earlier, in part driven by the higher infection rates amongst our over 65s. And likewise in this scenario, our rates of community infection are expected to peak at around 21,000 cases per day, similar to what they were in the first peak. However, we can see that if we do something here, this peak in hospitalisations, and this is critical, we can lower that peak if we take steps, if we all take steps to limit our exposure to the virus and protect ourselves. We will reduce that peak of hospital occupancy to under 1,000. Around 950 is what's modelled, and our community cases peaking at under 18,000. And so we can see this next slide really showing the difference there. And you'll all be aware of the pressure our hospitals, indeed our wider health system, including our general practices, are under. And so it's incumbent on all of us to do what we can to help reduce the number of infections and the impact on our health system. So what can you do this winter? Well, we anticipated a second wave of Omicron. We're seeing the impact of the BA5 subvariant. We've planned for it, and our colleagues across the system are doing sterling work, and my colleague Margie Upper will talk to that shortly. But the public health measures in place and the actions of us all are what will make the difference here. And so those steps need to be put in place to protect our vulnerable community members, our health system, and I might add our businesses and economy as well, to make sure they can function well. So correctly wearing an appropriate mask, such as a surgical or N95 mask, can help reduce the chance of being infected by at least half if you're doing it well. And now, if any of people out there are not wearing masks because it's a bit of a hassle or uncomfortable, I just want you to think of our health and disability workers who are wearing masks day in, day out during their entire time at work while they're dealing with this pressure. And my plea to you is, if they can do it, then you can do it. And if you do, that will help ensure we all get through winter in the best shape possible, including our health system. Testing, of course, remains crucial in reducing transmission and supports people following through on isolation. Unlike most other countries, we still have a requirement for everybody who tests positive and their household contacts to isolate, unless they've got a special exemption there, which is there to help our businesses keep operating. And likewise, vaccination. We've widened the accessibility to the flu vaccine, you all know. We've recently started our rollout of the 4th dose of the Pfizer vaccine with one of the widest eligibility criteria in the world, I might add. And our priority is on vaccinating those priority groups, our older people, people with pre-existing conditions, and anyone over 50, and our health workforce. We are keeping under close watch the interval. At the moment it's 6 months. We will look at whether or not there's indication to reduce that once we have really got into those priority groups vaccinated, as well as potentially extending and widening the eligible groups. We will keep that under advisement. But at the moment there are more than 1.7 million people who are eligible, and those are the highest risk people and the ones we want to vaccinate first. So we have in place a number of strong protective measures, including those I've outlined above. And if everyone does their bit, we will get through winter. As the Minister said, it's a very tough winter for our frontline staff. We know that. And my plea to you is to everybody in New Zealand is to do your bit for this next period of time, a couple of months, to just help us get through winter, in particular our health system. Now I'm going to hand over, we'll see the change on the screen. You'll see Margie Upper, the Chief Executive of Te Whatu Ora, Health New Zealand, appear, I hope, and she will talk about some of the pressures on the health system and how they are being responded to. Kia ora, Margie, over to you.
Tēnā koe, Ashley, and tēnā koe to you, Minister, and colleagues in the room. I'd just like to start by echoing the Minister's comments and acknowledge the hard work of our kaimahi, our frontline healthcare team. Community care are impacted by the same winter illness because we are part of the communities that we serve. And as we are seeing the rest of our country, we are seeing high numbers of staff away unwell or caring for dependents this winter, more than what we have seen in previous winters. So all of this increased demand does mean it can be harder at different points in time to get an appointment with your preferred health provider. And in some parts of the country, there can be longer waits than we would like to see. And I understand this impact this has on patients and their whānau. So we want you to know that Te Whatu Ora, we are moving to roll out national, regional and local initiatives to help manage system capacity. We're working regionally to manage demand, to prioritise urgent care and to deliver as much planned care as possible. We do understand how distressing it can be if your non-urgent surgery or outpatient visit is deferred because we've not been able to find the staffing. This is not our preferred way, and I just want to acknowledge this is a daily operational decision that can be affected by how many staff might ring in sick on any one day in the hospital. So hospitals are coordinating their daily planning, sometimes 2 or 3 times daily, to ensure that resources are deployed and shared to support access to care where it is needed. So aroha mai, we ask for some patience for our communities. Those who are urgent and need immediate care are getting access, and we know that many hospitals have been able to maintain planned care. The pressure is particular in our large metro urban-based hospitals who are seeing, some hospitals have reported this week, over 200 people reporting in sick in any one day. But we actually recognise that the need to support primary and community care and age residential care so that they can in turn support hospitals and avoid placing additional demand on them. But actually it's much more convenient for our families and communities to get care before even needing to leave home. So we are working on some initiatives to expand telehealth to alleviate pressures on ED and to provide more after hours options for patients. We do have initiatives that we can turn on if a hospital at any one particular point in time, and you have seen us exercise that in Capital Coast and Counties Manukau, where we do need extra urgent care to support those districts. This includes providing telehealth support for patients in an ED and enabling emergency ambulance services to have access to a GP or nurse over the phone so they can see and treat patients at the scene and reduce unnecessary admissions into hospital. We're working on national platforms to make it easier for GPs, ambulance services and Healthline to make direct referrals to radiology, reducing further the need for ED admissions or people waiting in hospital when they're otherwise well for a diagnostic. Opening hours for urgent care will also be extended into evenings and weekends where there is capacity to do so. And we want to acknowledge that primary care and urgent care services are facing the same kinds of staff illnesses as hospitals are. So that's to support people accessing care they need. Our focus is to make sure people get the right care at the right time in the right place and seek health advice early when they are unwell. By focusing on ensuring people access care early, and receive appropriate care or advice in the community, we can help our urgent health services remain available for those who need it most. Local pharmacists are a useful point of advice and guidance in managing winter illnesses, and they can make recommendations on the best over-the-counter medicines. If someone is sick, before you leave home, call Healthline on 0800 611 116 anytime, day or night, if you are unsure what to do. And Healthline can offer advice, which might offer you some other things to do before you even leave home. So it also helps our health services, and just echoing the Director General's guidance, if everyone can commit to help us get through winter in good shape. Thank you, Ashley.
Thank you, Dr. Bloomfield, and Te Pulai Amaji Apa. To get through this stage of the pandemic, we're going to have to use the most effective measures we have to reduce the spread of both COVID-19 and influenza, and by doing so reduce the pressures on the health system and leave resources for those who are most in need. We have weighed up whether moving to the red setting under the COVID protection framework would make enough of a significant difference to slow or reduce rising case numbers. The main difference in the red level, gathering limits, would likely only offer an incremental benefit. The vast majority of disease transmission is most likely to be occurring in places where most people spend the most time, their homes and workplaces of any size. Wearing masks, getting boosted, testing, and staying home if you're sick are the most effective ways to stop the spread of COVID-19. Our response to the pandemic has to be fast and flexible, but it also must be proportionate. We need to balance restrictions with practicality and effectiveness. These measures also help reduce the likelihood of catching flu and other winter illnesses, so that is why we are remaining at orange. However, we can improve how we are using the tools available to us at Orange, particularly masks, rapid antigen tests or RATs, and antivirals. Under the Orange setting, masks are required on public transport, in shops and in aged care facilities. You might think if you've had COVID-19, you don't need to wear a mask anymore, but the rapidly rising rates of reinfection show that that is not the case. Now is not the time to stop wearing masks. Evidence tells us wearing a mask halves your chance of being infected with COVID-19. It also helps protect you against influenza and other winter illnesses. So if you don't wear a mask for yourself, please wear one for our healthcare workers, especially over the next couple of months. To help more people wear masks, we will soon be providing free medical masks with RAT kits at all existing collection sites. P2 or N95 masks will be provided to those who are clinically vulnerable and high-risk individuals. We want people to test more. That's why we are removing the eligibility criteria for free RATs for individuals and their household members. You no longer have to say you have symptoms or be a household contact to get your RAT kits for free. However, please do continue to use the Request a RAT website to request RATs before you rock up to the collection point. It helps our team make sure we have the stock there for you. Also, the Ministry of Business, Innovation and Employment will be engaging with businesses to ensure they are aware of the guidelines for creating safe work environments. This includes ensuring people don't work when they're unwell, that mask use is encouraged, and that there's good ventilation at workplaces. Our message to business is simple. If you want to reduce the chance of your employees and customers getting sick, follow this public health advice. You're more likely to keep your doors open during winter. As you know, we have also recently announced a one-off supplementary energy payment to help schools better ventilate their classrooms without unaffordable heating and energy bills. And we have provided medical-grade masks for teachers and made child-sized masks available for children in years 4 to 7, and regular-sized masks for children year 8 and above. If schools take up the support in the coming term, their students will have more days at school and be healthier. Please use it. We are also launching a new campaign to encourage more people to get their booster shots and flu vaccinations. Health officials are calling and texting those who are eligible. If it's been 6 months since your first booster and 3 months since you've had the virus, please go get your second booster. Do it for our health sector and to keep yourself out of hospital. And importantly, if you feel sick, stay home and please test, test, test. For those who contract COVID-19, We want to see antivirals used much more widely as they are so effective at preventing hospitalisations. Today, Pharmac will be announcing expanded eligibility criteria for the antiviral tablets Paxlovid, Molnupiravir and the infusion Veklury. The change will take the percentage of people eligible for these drugs from 2% to 10% of cases, so approximately 400,000 people. The change will include a substantial simplification of the criteria. Anyone over 57 years of age will be eligible, and there will be improved access for Māori and Pacific peoples, as well as people with other risk factors. Pharmac will release the full criteria that includes these other risk groups today. One of these medicines, Paxlovid, reduces the chance of an at-risk person going to hospital by almost 90%. And to give you a sense of the potential impact of that, yesterday, more than half the people newly admitted to our hospital were over 70. To realise the benefit of these medicines in this outbreak, we have to make sure they reach the people who need it, when they need it. Now, currently, many people already access antivirals through their general practice. In addition, our care in the community team also identify people at high risk who report positive RATs via the website, and then they prioritise them for a call from their GP to make an assessment and issue a prescription. This is a great system, but we need to do more. Firstly, we are encouraging GPs to identify high-risk people under their care in advance of them becoming sick and assess if they are eligible for antivirals, and if so, write them a prescription to be dispensed when needed. This just-in-case approach is what we call a back-pocket prescription. The approach is widely used for antibiotics, and we can use it for antivirals too. We will ensure patients know they are eligible for antivirals by directly messaging them, so they know to seek care when they're unwell. Thirdly, we will make antiviral drugs available at pharmacies as pharmacy-only medications. This requires changes to regulation, and because these drugs have side effects, we will also offer training modules before this is taken up. So this change will be phased in over the coming fortnight. These measures, antivirals, but also masks, vaccines, ventilation, and staying home when you're sick, are the most effective measures we have. They are simple, but if we all do them, we can lessen illness burden and the burden on our health system. I know some people have said that the protections are too complicated for people, but they underestimate New Zealanders. Get vaccinated, wear a mask, stay home when you're sick, open a window. Finally, I want to reflect on conversations I've been having with friends and former colleagues working in the health system. They all report stories of the pressure that they're under. Rosters are tight. As you've heard from Margie, they're cross-covering and wards are busy. There can be delays getting people into ward beds or discharged, and that means they're having to provide care in ways they're not accustomed to. All of these deviations from normal practice carry some clinical risk, and managing that for the sake of our patients is tough on our professionals. I know they are busy, I know they are frustrated, and they also don't like to see planned care deferred, as we have seen in some instances. I know they are tired, and I want to thank them for the amazing work that they do. I also know that everyone is tired of COVID-19. We need to take these extra measures for a short time to get us and the healthcare system through the winter months. So please do your bit. Dr. Bloomfield and Margie Apa and I will take questions.
Minister, it is the middle of winter and we've seen cases that we have not seen since the sort of start of the outbreak. How has it been meant to get to this point before this intervention?
So we've optimised the interventions that we've had in place for a long time, and you'll see that what we've discussed today is improvements of a series of initiatives. So we've had the vaccination initiative in place for a long time. We brought that through with the change in Parliament to enable the fourth dose over a month ago. We've had to make sure that we've refocused the initiatives in schools. We've had access to antivirals, but as case numbers go up, we didn't see them increase at the way we wanted to when the pressure came on. That's why we've made this adjustment. And in terms of free testing, we've made that adjustment as we've seen that perhaps test numbers were going down over time. So, of course, we have had systems in place all along, but they do have to be optimised in response to the facts on the ground.
And the last time we saw case numbers like this, we were at red. So if not now, when? Or is red essentially now redundant?
No, it's not redundant. I think one of the themes that Kiwis have seen as we've gone through this pandemic, especially since September last year, is this is a virus that keeps changing, and therefore we do need a flexible response system. That is the purpose of the traffic lights. And if you read the stories, you'll know that we've had new variants on the horizon reported overseas out of India just in the last coming week. So we need to be able to continue to have a response that we can flex. But for the reasons I've outlined, we believe we can get through focusing on the basics of masks, vaccination, ventilation, and staying home when you're sick.
But if, given the absolute strain that you sort of all three of you have stood up there and basically begged the public to avoid going into the hospitals and do everything they can before having to get into the public health system, that speaks to the strain that it is under, and especially seeing the case numbers that we've got. If we're not moving to red now, will there ever be a time that we'll move to red? And then doesn't that undermine the whole traffic light system as it stands?
As I've explained, this virus can mutate and we need the ability to be able to change our response, and that's why we need a gradiated system like the traffic lights. Indeed, we know that the health system is under pressure, and that's why the imperative is on us to use the most effective measures. Those are vaccination, mask use, staying home when you're sick. We're supporting that with testing and widening the scope of antivirals.
Why not wider mandated mask use then?
What we need to do is to make sure that everyone knows right now wearing your mask will make a great difference to the situation in our health system. Thomas.
The main reason you just said for not going to red is that you believe that this is not where the transmission is occurring, the areas that will be clamped down on at red. So to sort of further on Amelia's question, what would be the circumstance where you would see the transmission in those areas so that you would go to red? Like, if not now, I can't really see. Can you explain when?
Yeah, so as we've seen throughout the pandemic, we've seen the transmission characteristics of the virus change as it mutates. And one of the things we've seen at the past is quite a dispersed range of different transmission situations, and a big concern about super spreading events earlier on in the pandemic. Those are the sorts of situations for which gathering limits might be very helpful. But if you look across what's going on now, people are catching COVID in their homes and workplaces, and it's pretty obvious just looking around that is where the vast majority of transmission is happening, and that's why we need to focus on that.
Mask use is getting increasingly slack, right? People just aren't wearing masks like they used to. It's really making them free to go and get at collection points. Is that really going to make a difference, do you think?
Yeah, we have to make sure there's no barriers to good mask use, including the cost. So we will make them more and more available, including N95s for medically vulnerable people. So I think the onus is on us to make sure there's no barriers to that, and also to make sure there's a very clear explanation to the public that masks are just critical right now for making sure we take the pressure off our hospitals.
Given how critical mask use is, was it a mistake to tell schools that they didn't need to wear masks, and to tell students it was up to them if they wanted to wear those masks?
Look, we at every level of the traffic light framework recommend mask use in schools, and what we mean when we recommend mask use is that you should do it.
Just on the barriers question, why haven't you guys essentially given everyone N95 masks instead of just the vulnerable, when you guys know that N95 masks make a massive difference in reducing transmission? And also just on the flu vaccine, why haven't you increased that to allowing everyone to get it for free?
So with medical masks, we know that they're incredibly effective and they are practical, and the guidance is for most people in community settings, they are good protection, and I wear a medical mask for that reason. We will provide N95s for those who are medically vulnerable, and that will come through at our collection points shortly. In terms of the flu vaccine, look, the advice that we received was that the flu vaccine to be effective, the flu vaccine is most effectively targeted at the groups that we're currently providing it to freely, and that's the basis on
But
which we
you
made
guys
that.
are essentially, creating a campaign to encourage people to do it. Isn't payment a barrier to them?
Well, we think the flu vaccine is targeted at those is funded for those groups most at risk of hospitalisation.
In hindsight,
If the red setting will only give an incremental benefit, I think those were your words, is the traffic light system fit for purpose dealing with Omicron and the subvariants that we're seeing now?
I think the second part of your question gets at precisely the point, which is that we need flexibility in order to respond to a virus that frequently changes, and indeed having the options of titrating up protections should we need it is incredibly important for our safety from
But those
future variants.
protections in the red level you're saying aren't aligned with the sort of transmission dynamics we're seeing. So why not, shouldn't we have a traffic light system that you can actually move between levels to respond to the situation in the community?
Well,
Just to make it up.
I've explained that we do have the traffic light system in order to be able to respond to changes in the virus. But I think the most important thing here is that currently what we are seeing is a virus that masks, vaccinations, and testing and staying home when you're sick and antivirals will be incredibly effective for. So whether we were going to red, where there are more mandated settings, wouldn't impact, even at red, I would still be asking people to do exactly the same things that we're asking them to do at orange.
But you would have to rewrite the red setting.
When did you start looking at this one axis? Has this been something that works for a while, because this could have been brought in the last wave, is that not?
Widened access to antivirals.
Sorry, access to rats and masks. Has that been in the works for a while?
We've been working on that particular part for a couple of weeks. Yeah.
Was that not ever considered in the initial Omicron outbreak?
Indeed, different settings were considered, but we're in quite a different situation in terms of rat availability, and we've seen how it's being used. I think that's the important thing. We've been concerned that the test positivity rate is going up, and it means people may not be testing as much as previously, and so that was one of the prompts for making the
Do you
change.
think that the advice on targeting the flu vaccine was broadly correct, or do you, with hindsight, wish that the advice had recommended a slightly broader targeting of the flu vaccine?
Look, I haven't given that much consideration, but it is, it's certainly appropriately targeted at those at the highest risk.
Public health experts are saying that we need to be moving towards becoming a mask-wearing society, including having to use, sort of public health campaigns a la Don't Drink Drive, wear your mask to protect others. Why are we not rolling out sort of a public awareness campaign like we do with drink driving?
Oh, we are rolling out a campaign to promote greater mask use, and you've heard that message consistently from Dr. Bloomfield today, and we will have we'll have a advertising campaign promoting the message that masks matter, hitting screens very soon. I'm just going to pause here because, as you know, Margie Appa will be leaving us soon. So if you have any questions for Margie about how the health system is responding to these demand pressures, would you like to ask her now?
Yeah, what's going to it's already under pressure. What's going to happen, when we hit those really high numbers in a few weeks' time?
Look, I think much of what we do at the moment is in every hospital, particularly, and I know in primary and community services, we monitor the situation daily, and we deploy people as we are now. We know our workforce are helping each other, where we've got people who are doing more work or shifts, and we have to make sure that we are keeping them well and not burning people out. So those daily operational rhythms of monitoring what happens and how we move resources around to support what we have now, which we didn't have before 1 July, as Te Whatu Ora, is much greater regional coordination and collaboration, looking at escalation models within individual hospitals and where regions are able to support each other. So all those operational rhythms are part of how we will manage the system and supporting our workforce.
If I could just go back to the masks. Thank you. So just if you're rolling out this mask campaign now, why have you waited until the middle of winter when we're getting 13,000 cases a day? Why not roll this out at the start of winter when clearly this was going to be coming down the traps towards us?
Look, I think what we're talking about is a refresh of a number of government messages, but we in particular want to, and we have had supply and we have had recommendations for masks for some time now. So what we're doing is just re-emphasising, as we should, when our health system is under so much
Māori
pressure.
and Pacifica are the most vulnerable in that age cohort, that's right. But when they go in to get vaccinated, they take in whole whānau lots. So why don't you just allow whole whānau lots to be vaccinated rather than still targeting that age cohort, which didn't work for us the first time round?
Yeah, so firstly, we recognise being Māori or Pacifica as an additional risk factor, which is why the recommendation for vaccination for a fourth dose or a second booster has a lower age level for both Māori and Pacific people. We do encourage whānau to come together to be vaccinated, which might not just be for COVID, it might be for influenza, and so we're making those opportunities available to the whole whānau at once. And but I think just the lower limit of who we are offering the vaccine to, it is really important to be aware that there are rare side effects that become more frequent at the younger age group, and that's why we have a lower age limit at the moment, and we continue to track whether or not it's safe to widen access there.
How confident are you that Māori organisations are confident that this strategy will work for them?
So we've worked closely with Māori organisations, both at the ministry and Te Whatu Ora level, and increasingly at a sort of township by township level, particularly for the tamariki vaccination campaign. So we've got to a place where there are multiple points of contact between the vaccination rollout and actually the health system as a whole, and hapu and iwi groups.
Can we just ask some questions of Dr.
Certainly.
Dr. Benfield, what was the recommendation for mask use? Was it to expand the requirements in certain settings at all?
The recommendation for mask use is the one that's been picked up, and that is just a reminder, actually there are still a number of places where people are required to use masks. We've seen a drop-off in that use of masks in places like supermarkets, public transport and so on. So the first thing is reiterating for people that's important. For the last few weeks you'll have heard me saying, and you'll have seen in our media releases, a good rule of thumb is to wear a mask in any indoor place outside your home.
And
the key thing we're doing here is, as the Minister said, making sure that people are able to access those masks. And I would say that's not a new thing. We have already distributed hundreds of thousands, if not millions, of the medical masks and indeed the N95 masks out through Māori and Pacific providers, disability providers and so on. So they've been out for some time. What we're doing now is just ramping that up and also ensuring that masks are provided with rapid antigen tests as well. So there's strong support for people to use masks whenever they are outside the home.
And do you support the cause that it should be seen, we should be more of a mask-wearing society, that it should be looked at, like we look at sort of smoking in restaurants or drink driving, we need to move to that sort of more long-term and in the immediate future as well?
Absolutely, for the time being, and this is the point, is we're in the middle of an Omicron resurgence with a new variant. Mask wearing should be like wearing a seat belt, absolutely, and that's why we still have an order which requires people to wear them in a number of indoor environments, and we're encouraging and supporting people to use them in a wider range of indoor environments as well, including in schools by, as the announcement was a couple of weeks ago, providing masks to schools for children and staff.
So what about the strategy for our whaikaha whānau who aren't able to, because we've got a lot of reports about them being abused because they simply cannot. So what's the strategy for them?
Well, I think the strategy there is for us all to take that on board, that actually there will be some people who are unable to wear a mask, and those people can, and many of them have applied for an exemption, which is a legitimate exemption, and we must be open and generous and kind to those people who can't wear a mask. By the same token, those of us who can should show an example and wear masks, including to protect our tangata whaikaha and other vulnerable people who are not able to wear masks.
They've been prohibited from going into things like supermarkets, as an example, being abused by bus drivers, not being allowed on the buses. How will that be overcome?
I think our supermarkets are very aware that if people have got an exemption, then they should be, and I have not seen reports or we haven't heard reports of problems in supermarkets. I certainly read the story in the media today, and I think that's an important reminder to everybody, including our businesses and our bus drivers, that some people will have an exemption, and if they do have it, that will be a legitimate one.
There's a lot of language.
You said before, you showed the modelling before of the peaks in the second wave, if we didn't do anything and if we didn't. Can you just say where you're expecting this wave to peak? And are you sort of seeing similar modelling in terms of, Auckland peaking first in the second wave, or regional, differences in that case?
Well, you saw on the first slide that rates are going up right around the country. So it's different from when we had the first Omicron wave, which was very much Auckland-based to start with. Likewise, hospitalisations are increasing around the motu. And so we've got high numbers in all our districts and regions around the country. In terms of the peak, we've seen that increase in the 7-day rate of positive cases. However, the last few days have been quite steady. The point is here, it is up to all of us, and we have it within our reach, to actually level off that peak at either this current level or not much higher, and that is what will make the biggest difference to the number of hospitalisations, because our more vulnerable people, including our older citizens, are less likely to be infected if we all take those measures we've talked about today.
But with the current implementations, that have been announced today, when are you expecting the peak to be reached? And essentially.
At the moment, the modelling is suggesting, the peak in cases will be about a week before the peak in hospitalisations, so sometime in the second half of July is what the modelling suggests.
There's a lot of language around encouragement.
What would you advise Cabinet that Cabinet should do around settings in the traffic light system? Did you advise we should move to red?
No, our advice was to remain on the orange setting, but one of the things our team is doing, and they're doing this today, is to look at, as the Minister described, if we were going to have to add in more stringent measures, either through this Omicron wave or because of a variant in the future, what are the settings that perhaps we should have in red, including indoor gathering size limits and so on, because our sense was that the current indoor gathering size limit was unlikely to make much of a difference, and that these were the important measures. And the measures in orange that we've talked about today are still the fundamental measures in red as well.
Right. So would you say that the traffic light system as it is now isn't aligned with what we need to fight BA5?
I think that the orange setting, including the mask requirements and so on, are good for now. However, we have offered to and been asked to have another look at the current red settings to see if they did need to be deployed, whether they would actually make an incremental difference. In particular, if we had a new subvariant or a new variant that had a greater impact than Omicron. There's a question
There's a lot
at
of
the
language
front
around
here.
encouraging and telling people to do the right thing. Sure, you're making masks accessible to more people. How are you going to enforce it? Like Benedict said, compliance has gone down. Why? What can you do to actually enforce this and tell people, look, that peak's going to hit if you don't do it?
Well, that's why we're here today. And just a reminder to people that there are many settings where masks are required, and we're reiterating that and also supporting them to do that. And the Minister may want to comment as well, but this is why we're making masks more available. However, am I confident people will listen and follow through on the message? I am, because we've seen that New Zealand's successful response in the pandemic to date has relied on people doing the right thing. There is no way we could police our way through a lockdown. It relied on people actually doing the right thing, and they did it. And our message here today is it's important that people, again, recommit. We're not through this yet. It's time limited. We need to help our health system and indeed our older people get through winter in good shape, and that's why we're here today asking people to do that and also showing what we're doing to support that.
And what are rat and mask stocks? What are they looking like in New Zealand?
Very good, and that's one of the reasons why we feel confident that widening access is not only a good thing to do, but it's doable in terms of our stocks, and we'd rather have these things being used than sitting on the shelves.
And how many can people go out and claim? Can they just go out and hoard them? Or
well, definitely not. That people should. The whole idea is to enable and support people to use them appropriately. They're not there. The rats are not there for businesses to pick up to do whatever testing they might want to in their businesses, nor masks. It's not a replacement for businesses doing the right thing. It is to enable individuals and whānau to be able to use masks as and when it's appropriate, and to have access to tests. And a good example might be if someone, and the most important use of using the test is if you're asymptomatic or a household contact. Someone might be visiting an elderly relative. They might have been exposed a couple of days ago to someone they've heard about. They might not be symptomatic, but they might want to do a rat before they go. So I trust people to be sensible around that.
To go back to the
people to use them appropriately. They're not there